Hi guys, I'm Dr. Coulter. I'm here with our physician assistant Autumn, and welcome to Couch Talk here at FAM.
Hey.
So today, Autumn, I think a good thing for us to talk about is this new wave of medicines that is helping people lose weight. And a very famous one that everyone knows about is called Ozempic, right? So let's talk about Ozempic and talk about some myths about it and then what it's really used for. So tell everybody, what exactly is Ozempic?
So Ozempic is a kind of like a brand new novel class of medication. So Ozempic was one of the first ones to come out. It's considered a GLP inhibitor. Fancy way of saying it blocks one specific hormone, GLP. By blocking that, it's going to help your body release more insulin. But really how everybody kind of thinks about it is that it keeps food in your stomach for longer. And so by doing that, we eat less, which means that you're not taking in as much sugar, whether that be like carbs, like sweets, or actual like complex carbs like pastas, bread, stuff like that. So by eating less, we're going to be introducing less sugar to our body, which means we're going to be helping control our blood sugar levels.
Well, is that really what people are interested in Ozempic for?
No, it's for the weight loss.
It's for the weight loss. So I think we need to talk about like who can use it and who can't, and let everybody know that we're here to help if they're interested, right? And so what was Ozempic initially discovered for?
So it was initially used for diabetes. And so it was created to be a diabetic medicine, except everybody started noticing that they had the happy side effect of weight loss. And so that's usually what happens with these medications is we design it for one specific reason, and then we kind of see whenever we give it to everybody, oh, it kind of works on this, or it works better for this, vice versa.
Yeah, I got super excited about the weight loss. So I remember when the reps initially came to talk to us about Ozempic and about the diabetes and whatnot. And so I started seeing the reports that they showed us, right? So all the drug reps come and they show all the evidence of like what their drug actually does. And I think for me and for a lot of physicians, what really, really sparked our interest and made Ozempic stand out more than a lot of other diabetic medicines was the benefit of the weight loss, right? And so when you think about it, you're going to the root cause of why a lot of people develop diabetes in the first place, especially type 2 diabetes, right? It's all related to obesity. There's so many diseases related to it. So if I can go to the root cause, not just treat the diabetes like metformin or glyburide or things like that, but I'm actually causing you to lose weight, which in that sense controls diabetes much better. And I've had so many patients who either have been able to get their diabetes under really good control or be able to even come off of the medicine. So that's why Ozempic came out, right? It's all about diabetes, right? So when people are talking about the weight loss, they have to understand that if they ask insurance for Ozempic, or they call their insurance company and say, do you cover Ozempic? They're going to get an astounding yes from the insurance company. But does that mean they actually qualify to take Ozempic?
No. So sometimes even if you ask them, do you cover Ozempic for weight management? Sometimes they'll even say, sure, but then they'll cover like $100 off of a $1,200 medication. But the reason why they're not covering it well is because that's not what it's indicated for. So that's not what it was made for or approved for. And so to combat that, Ozempic, or the company who makes it, is like, but this works for weight loss too. So how about we take the same medication, slap a different label on it, even though it's made in the same place by the same people, and then call it Wegovy.
Yeah. So that's really important, right? As we're like busting these myths. Is Ozempic for weight loss? The answer is no. But Ozempic through another name, right? Wegovy is used for weight loss. And so you have to make sure that you're asking for the Wegovy if you are not a diabetic, right? To get the benefits of the weight loss. So we saw Ozempic really surge during the pandemic, especially people were logging on more so on like Zoom calls for work. They weren't having to go in, but they also were seeing themselves on camera, and they were staying at home, not as active when the pandemic hit, which meant that I'm more sedentary, meaning sitting around more. They didn't even have to get dressed. People were like dressed up from the waist up, and then they had the pajamas, right? But then they started noticing, like, I have gained weight during this period as well. And so we started seeing a lot of celebrities like Oprah Winfrey and different people come out and start to say, like, you're like, oh gosh, they look really good. So they were doing the opposite during the pandemic. They were losing weight when everybody else was gaining. So people were like, oh, that's just for celebrities, right? All the celebrities are on this new like weight loss shot. They were talking about it on the Real Housewives. Like, everybody started getting on it. And one of the reasons that we saw a lot of famous people with it is because, one, it was really costly and the famous people were able to like afford it. But when you talk about us, like our everyday people, how hard is it to get it, or is it just not meant for us? It's just for the rich and famous.
No, you can still definitely get it. So there are ways that I think that most of us have, by us I mean like clinicians, we figured out, because realistically, even if it's like I'm overweight, I don't have diabetes, but maybe I have blood pressure, or maybe I have this, and maybe I've been exercising so much and eating so right, but I am a 55-year-old woman and weight just doesn't drop like it used to, right? And so we like, you should still be able to treat your obesity and hopefully treat the blood pressure and everything like that through that, even if you don't have that diagnosis of diabetes. And so there's a few ways that we've gone around it. You can get covered for Wegovy, which is basically the weight management version of Ozempic. Or even nowadays, they're having compound pharmacies make it, which makes it more affordable for everybody else who is not flush with cash like the celebrities are to have this medicine. Yeah,
so there was a big surge during the Super Bowl. That I saw an article came out that said hemsandhers.com, right? Like, they had this huge uptick in people calling, and Ozempic sales actually went down because people started seeing that they can get it online for free. But I do want people to understand, like, you need a provider, right? You cannot get it from your homegirl. You cannot get it from the guy down the street who got the hookup, because they are not managing you. And what I mean by that is, no medicine created by man comes without a potential side effect, right? So you need someone in medicine who actually understands what to look for, because you could be giving yourself shots. You could give it wrong, right? You could be giving yourself a shot every day instead of how it's meant to be taken, like once a week. There are potential side effects due to dehydration, pancreatitis, nausea, vomiting, kidneys being so dried out that people have acute kidney injury. And there are some studies that show that people have had so much damage that it led to them actually needing dialysis, right? So you can't just randomly say, I'm just gonna go get it, I'm gonna get the cheapest version. You have to be safe. You need to go to a trusted provider, medical provider. And what I mean by that is like a doctor or a physician assistant who knows the medicine, who knows what to look for, right? Because the last thing you want is to be on this like journey to weight loss and end up in the hospital, right? Because you're not doing it correctly.
No, I completely agree. That's what I like that we do with our clinic specifically, is that we usually try and check kidney function about every 3 months. We know exactly what everybody else knows about this medication, so about how the 7-year outlook looks. So we know what everybody looks like in about 7 years, because that's about how old the medicine is. We don't know 10 years. But
or at least not the studies, right? We don't have the outcomes for it.
But at the same time, it's still such a good medication, and patients are seeing such a good prognoses with the medication that for the risk versus benefits, it's definitely worth it if you're being watched closely by some sort of medical provider. Yeah,
and then if that provider is seeing change because they're actually monitoring you, you're not just paying for the medicine and walking out the door. If nobody talks to you about this medicine, if nobody's monitoring you on this medicine, you might need to find somebody else, you know? So sometimes just because it's online and available doesn't mean it's the safest option for you. So talk to your local primary care provider or your local weight loss medicine specialist. But make sure that there's somebody who is versed and educated in it, right? Okay, so there is a competitor to Ozempic.
There is.
Okay, and who is that competitor?
That would be Mounjaro. And so Ozempic works on that one hormone, the GLP. Mounjaro came out afterwards, and they said, we're going to do a hair bit more. So they did GLP and GIP. So it works on two different places. So you kind of get like a double punch. Because of it, you usually lose weight faster And in regards to diabetes, we see your hemoglobin A1C or like your blood sugar numbers going down faster. So I think that it's kind of getting into more of a, what do you call it, like a preference.
Yeah, and studies actually say you lose more weight with the Mounjaro, right, than you do with the Ozempic, which I'm not sure that Mounjaro has really taken off the way Ozempic did, and I have my theories about that. I think most of it is cost, right, because Mounjaro is also a little bit more expensive than Ozempic. And when we're talking expensive, right, like for people who have insurance, what percentage of your patients would you say that their insurance actually does cover Ozempic or Mounjaro when they're thinking about weight loss, not the diabetes aspect?
Very rare. I'd say probably 10% or less. And if they are, I'm like, where do you work?
Yes.
Because I'm curious.
Yes. So we actually now know those companies whose insurance is likely going to cover. And then I would say 80 to 90% of our patients, when we write the prescription, sometimes, most of the time, their insurance doesn't cover it significantly, right? So the cost of these medicines is anywhere from $1,200 to $1,500 for just a 1 month supply. That means only 4 shots. And no one, I don't care what you do, I don't even care if you went for weight loss surgery, no one loses all their weight in 1 month, right?
That's not healthy,
so you have to really plan that this is going to be an investment, right? And you have to decide that the investment for your overall health is worth it, because what we do see when people lose weight is their blood pressure comes down. I can tell you, I have multiple patients who have no longer needed to be on blood pressure medicine because they have lost the weight, right? I can tell you that your A1C goes down. So not just for people with diabetes, but the pre-diabetes, right? And then you said, what else goes down?
Cholesterol too. And so cholesterol's kind of picky too. We check for it every single year because we need to, but cholesterol doesn't necessarily give you symptoms like high blood pressure or diabetes will. So it's kind of like more quietly in the background. Yeah. But if you lose weight, and also if you're eating less, including like fried foods or just like less in general, that cholesterol is going to fall right back down. And so I think about like blood pressure, diabetes, and cholesterol is kind of like the big three related to obesity. And so whenever you lose weight, those big three just minimize. Yeah.
And as healthcare providers, those things are important to us, right? But to the general population,
they just want to be skinny. And I don't blame them.
Right. It's the skinny shot. They want to look good. So there are some patients who are like, I want to lose weight, but I don't want to lose my butt. I don't want the flabby butt. Okay, for those patients, what do you tell them?
I say start training. So I do think that whenever we lose weight, no matter what you do besides liposuction, you do not get to choose where you lose weight from. So even if you started running like marathons, that's great. You don't choose where you lose weight. You just lose weight generally. What you do choose is which muscles you want to build up. So whenever you lose weight, you look toned and you don't look flat flabby like they would say.
Yeah. So you can't say, okay, I want to lose 20 pounds here in my stomach, but I want to keep about 10 in my back side.
The back side is just going to be muscle if you want to maintain it too, because we can lose weight from everywhere, but if you want to make sure that one side looks or like something looks really, really good, you have to start training it by exercise.
You have to work out, right? Yeah. So nothing is magical about getting the perfect body, even when you do these shots. So the understanding is when I lose weight, I'm losing weight everywhere, right? The bra size will change for women, the hip size will change, the waist circumference will change. And if you are built like a Coca-Cola bottle, you still gonna keep your Coca-Cola shape, but you're gonna be smaller, right? If you are built straight down, you're gonna be straight down. So it doesn't change genetics, right? But you will lose weight overall. Okay. So that's important. You sounded like you wanted to say something else.
I was just gonna ask you, how do you keep the weight off?
Okay, so for those who say, I just need to get good for my vacation this summer, I want the beach body, right? Some people come in here and they expect, you just give me the shot, I'm going to lose the weight, right? And people actually do lose the weight, even if they don't do anything else. However, you will be back to see us if that is all you depended on is the shot. So everyone should be advised that the shot is not the only thing that you should be doing, but you should be maintaining a healthy lifestyle. You should exercise while you do the shot. You should change your diet while you do the shot. Because here's the thing, what got you to the point of that particular weight that you said I need to lose it? It's how you ate, and it's the fact that you weren't exercising, right? So if you never want to go back to that weight, you got to maintain the exercise and the healthy eating. So we are next door to a Wingstop, right?
And a Shipley's.
So if our patients are like, I'm gonna come and get that shot, but then they go next door to Shipley's or Wingstop, they are going to be back. We're gonna see you in a couple of months, okay? However, if you said, you know what, instead I'm gonna go get lunch at Salada, or I'm gonna go to Cava, or I'm gonna make my own food at home because I know that this is healthier, and I am going to come up with a workout plan that I am going to maintain, because this is a lifestyle thing. If you want to be at that weight and maintain that weight and be happy at that weight, you got to do the work. And if you don't do the work, we will see you again. Now, we don't mind. We're providers. You can always come back. However, we want to see you be successful in the long run. And again, that's the difference between people who care as providers and people who are just in this for the money, right? Like, they will write the prescription or figure out how to hustle and get it for you, but they're not counseling their patients and are not watching out for side effects. So again, a trusted provider is really important. Ozempic face. Have you heard about the Ozempic face?
I have.
Okay.
So you know how we just talked about where you don't choose where you lose weight from? Whenever we lose weight from the fat in our face too. Whenever we're young, it just kind of like slims down your face. Whenever you're not like 16, some of that fat in your face kind of gives you a little bit of like fullness, and it kind of still does make you look a little bit like youthful, because it kind of like gives you those like cherry or like rosy cheeks, I guess. Whenever you lose weight, especially if you lose weight rapidly, sometimes you lose weight from your face, and people are saying now they look gaunt or like kind of like hollowed out, and so that's the Ozempic face. Yeah,
and unfortunately, you can tone your body, right? You can, if you want to focus on problem areas, you can do your squats and your sit-ups and those kinds of things. But unfortunately, I don't know an exercise for the face.
I don't think it'd be worth it. I feel like it'd give you like TMJ if you tried.
Yeah. So I have seen some people like revert to the med spas, do the fillers, things like that, in order to kind of combat that. And that's a whole nother, couch talk. But I think, people just have to be aware of the potential. And anyone who loses weight is going to lose in their face, whether it is weight loss surgery or that kind of thing. Now, what about when people think about how much this costs? What are some options that they can look at in the sense of trying to combat the high prices of the medication?
Yeah, so what we usually say is we want our patients to kind of be informed. That way they don't feel like they're being like bamboozled whenever they go to pick up the medication at the pharmacy. So what we usually have our patients do is that we have them call their insurance, and then I give them a list of medications. And so that includes Ozempic and this Wegovy, which is the same thing. It's just the different label slapped on it. And then I include Mounjaro, and Mounjaro has a similar thing where it's the same thing. It's just for weight management, and that's called Zepbound. So I give them this list, and I tell them to ask their insurance, is anything covered for weight management? And if it's covered, how much of it is covered? Sometimes insurances like to play a game where they're like, you just need to do a prior auth, where basically they ask our office a few questions, we send it back, and then they determine how much is covered. Sometimes they'll say, oh, it's X amount off, so that you can fully know how much do I expect to spend at the pharmacy. Yeah.
So they might take $200 off, but the medicine is $1,200.
So you're still
gonna owe $1,000, right? So there are some ways, like we have a weight loss program where you have a significant amount of cost savings from that standpoint. Some people will use their FSA card, so they can set that money aside. It'll be not taxed, right? And then they can use that in order to pay for their medications. So there's a lot of different options that we can kind of help patients walk through the steps. And then I also say this. In the end, even if you pay the $1,200 a month for a total of 12 months, you're still going to spend less than you would for a weight loss surgery, right? You wouldn't have to go under the knife, have to deal with anesthesia. And these medicines give you the same results that weight loss surgery is given, so people are getting those same results. And so I would say when you look at how much you want to invest in you, this may look like a big amount, but in the long run, if you're able to come off of blood pressure medicine, if you no longer have to take medications for diabetes, if you can decrease your medications. Some people have to see the doctor monthly, right? Because their blood pressures are so uncontrolled. But if you only have to go every 3 to 6 months, like all of this is going to be cost savings. And on top of that, it's adding years to your life rather than taking years away because of all the things that come along with obesity in and of itself. So for our diabetics, definitely ask about coverage for Ozempic and Mounjaro, right?
Specifically for diabetes.
And can type 1 and type 2 diabetics take Ozempic?
No, so it's just the method of how the medicine works. And so the medicine works by increasing your insulin supply, but with type 1 diabetics, they really don't have much going on in insulin production. So they're not the ones who they ate bad or they have obesity and stuff like that. That's why they have diabetes. It's not that their pancreas is starting to slow down. Their pancreas was just stopped from the beginning almost. And so the medicine won't help them. So it's not for type 1 diabetics.
And there are some other people who can't take Ozempic, right?
Yeah. So if you have a history of thyroid cancers, they noticed a link in between those. And then I think that they're also saying gastroparesis, which is basically like your stomach, your intestines, that highway, if you will, just stops. And so this medicine, it slows down your appetite and it slows down your gastric emptying and your intestines. And so with that, you eat less because you feel full, but that's also because the food is taking its time moving through. If your stomach's already stopped and we slow it down even more, then we just can't do that. But those are pretty rare too. That's not super common.
And then for people with depression, it's not that you can't take it, but you need to be aware that there are some reports that depression can worsen with Ozempic, or it can literally cause depression in some people. So if you are taking a shot and you're noticed that your mood is changing, you're becoming more depressed, again, schedule an appointment with your healthcare provider. And it may be just switching from the Wegovy/Ozempic to the Mounjaro/Zepbound, or vice versa, so to speak. So sometimes people do better with one versus the other. But
if you also get it from a medical clinic, that provider can also manage the depression as well. If you're I'm doing so good and I'm losing all the weight, the depression isn't bad, I don't want to stop it. Well, we actually have ways that we can help with that too. So we can manage just about any side effect, really.
Yeah. So that was really good. I think we kind of bust some myths about Ozempic, and told some truths about Ozempic, and in ways that people can learn a little bit more about it. They can always reach out to us.
Definitely.
Or if you don't live here in Houston, then definitely reach out to your local health provider. All right, guys. See you next time.
Bye.